I came into urology because there's this allure of surgery, being able to work with your hands, figure out problems, use technology. There's a satisfaction to restoring function, but also making things look the way you expect them to look. And with pediatrics, there's also a good amount of what we do that doesn't involve surgery. So it's clinical, it's medical, it's behavioral. And so I think you get sort of the best of both worlds when you're in this particular specialty. One of the key things is establishing a good trust relationship, rapport with the family, and more importantly with the patient. It can be one thing to be talking with another adult and explaining what's going on, and it's another thing to find the language with which to speak to children and determine exactly what's bothering them, if they're worried about anything, if they're experiencing any pain. As a parent myself, I have an appreciation for what it's like to worry. I think it's natural for parents to worry about their children. I feel like I can empathize with that. We've all been up at night worrying and wondering, and I feel like one of my main jobs here is to come at it with an appreciation for that, and also to try to explain and reassure whenever possible so that we can move forward with the next steps of treatment. We do have patients where their particular diagnoses are lifelong conditions, and that's another aspect that can be very satisfying and also very challenging. So to meet a family and a patient in infancy or as a young baby, and to watch that child grow and change and have to adapt your recommendations, your treatments, your surgeries to that particular stage of growth can be a difficult but also rewarding aspect. We understand that this is a pretty sensitive area and that sometimes it's embarrassing for families or patients to want to discuss that. And that's something we're very familiar with, but I think we're also very good at handling. And sometimes some of the things that we recommend for treatments or evaluation can sound a little bit scary or a little bit intimidating. And we definitely have our team of experts to help guide our families and our patients through all of those steps. One of the most satisfying things about treating children is kind of how quickly they recover and bounce back and get on with living and doing their own thing.